Hello, everyone. Thank you for being here today. I'm Andrea Gallo. I'm on the Press Club board, and today we have 4 speakers for you. We will be talking about the tax that some of you may have seen if you early voted, or if you're planning to vote on Saturday, you'll see it then, for the Brpc Center, which is a mental health facility that has long been pushed for in Baton Rouge. So today we will hear from Kathy Kleber, who is the board chair of the Brpc Center and former DHH secretary, District Attorney Hiller Moore, Coroner Bill Clark, and Police Chief Murphy Hall. Just a couple housekeeping reminders for our speakers. When we take questions, we ask that you repeat the questions so that everybody can hear them. And only members of the working media or press club are allowed to ask questions. Thank you guys so much.
Thank you. I appreciate y'all having us this afternoon to talk about this very important issue. As she mentioned, I was the former secretary of the Department of Health. Spent the majority of my 28 years in working with either developmental disabilities or behavioral health. So I have a lot of experience in this area and know all too well what happens when we don't have good mental health services. So I'm going to talk to you today about what the tax is, what you will actually be buying with the tax money, and then we'll have the other presenters talk about how important it is to their entities as well. So what's our goal? Stabilization. Breaking the crisis cycle, getting people the care they need, making up for lost resources, preventing crime and substance abuse, reducing reliance on jail and the ER. As many of you know, that's the 2 places we have right now. If somebody has a mental health issue, they're either going to jail or they're going to the ER. Neither of those appropriate places for treatment. So what are we voting on? It's a 1.5 millage request of residents, which would garner about $6 million for annual operations of a mental health crisis stabilization center. For the average homeowner, that's about $1,875 a year or $1.50 a month. And there'll be $55 million in savings for the community over the course of the tax. In large part, keeping people out of the jails and the ERs. This is not using police time, the amount of money you save there, as well as not buying beds out of parish, which we do right now, as well as numerous other savings that result when people can get treatment and return to be valued members of the community. So we have mental health services here in Baton Rouge. All of us know, there are providers that provide both inpatient, outpatient treatment. We have substance abuse services, but we're missing an extremely critical part of the continuum, and that's the front end part of the continuum. So what this center will do, will provide a mobile assessment team, which would allow that team to go out to either a family who might call, or if the police call and need assistance, that team can go out and on the spot assess somebody in a mental health crisis or a substance abuse crisis, and then bring them back to the center for stabilization. It also provides a sobering center, medical detox. We do have some medical detox in the community already, but if those aren't available, we will also provide some of those services. Provides respite in acute psych. Right now, what family members need more than anything, when they have a child or a family member, a brother, sister, uncle, who has a mental health crisis, they need some place for that individual to go for a short period of time. Most people do not need long-term treatment. They simply need a place to go where somebody can assess, stabilize them, get them on some initial medications, and then follow them along to get to a longer-term treatment plan, which most of the time can be outpatient treatment, that once they're stabilized, and then we don't lose that connection with the family. What happens when people go to jail, ERs, or long-term psychiatric institutions, you lose that connection with the family. And it's much, much harder to get the support they need to remain in the community once you lose that connection. And then, like I said, that ending part is so important as well, following along to make sure The center will have a lot of social workers that can provide care management, make sure they're connected to treatment, and then that they stay in treatment. One of the best things you can do in mental health or substance abuse care is make sure that people stay engaged. They're much less likely to relapse if they stay engaged. Providing that care management keeps them engaged in their treatment services. We modeled it after the San Antonio model. We all at the Bridge Center have visited numerous times, as well as councilwomen and men have been to visit, as well as all of the major players in the community regarding mental health services and law enforcement services have visited and looked at the success of this model. They've had tremendous success in keeping people out of jail and keeping people out of hospitals. They've had over $50 million in taxpayer savings just in the first 5 years. They diverted 17,000 people from jails and emergency rooms into care. Trained over 2,600 law enforcement officers in the 40-hour crisis intervention team training mode. Reduced overcrowding in the Bexar County Jail. This is probably one of the most interesting statistics to me. They thought they would need 1,000 new beds in the jail system there in Bexar County. And after initiation of this program, and this program had been working for a couple of years, now they have 600 empty beds. A swing of 1,600 beds just by providing crisis stabilization and mental health services. That is, I think, like I said, one of the most significant statistics for me. It's funded there by a combination of public and private funds. So again, what they did there was provide those mental health services on the front end rather than after people are institutionalized. Real important part of this is the public safety benefits. Each Baton Rouge Parish law enforcement officers spend a significant amount of time on their shifts de-escalating mental health crises, transporting individuals across town and ER, or waiting to book people once they've determined they don't have any other place and they need to go to jail. So they wait for them to be admitted or wait for them to be booked, sometimes using 4 to 12 hours of a shift of their time instead of being back on the streets providing public safety. So they spend time being a taxi service, time lost on patrols, responding to issues, or working to prevent other crimes. And we know we have a lot of violent crime, some of the highest levels of violent crime. We need our police officers back on the streets fighting that violent crime rather than dealing with mental health issues, which can be best dealt with through treatment. We've worked really hard over the past several years since the first proposition failed to make sure that we used grant money to launch a pretrial release program. We got grant funding. We looked at all sources of funding across the continuum. We looked at all the services that were available in Baton Rouge and made sure that we're only asking for those services that are not currently funded. There are no crisis stabilization centers in all of Louisiana. And the reason there are none because there's not funding for those services. Medicaid will pay a small amount of the funding needed to do that service, not nearly enough to fund the service, so nobody will do it. There's not a private provider that will do this. You have to have either local or state funding to do it. We haven't been able to, we had state funding at one point, that dried up. We know local funding is the best way to make sure that these services can be provided. And again, we worked really hard to make sure that we were only asking for those services that didn't have other sources of funding or other providers providing those services. So just to recap, why do we want you to vote yes? Saves money, saves time and lives. Again, it keeps nonviolent individuals in crisis out of jails and ER, connecting them to the care they need for continued recovery and to get back into the community. Frees up law enforcement time to focus on preventing and responding to real crime and addressing other community needs. And most importantly, by saving lives. It addresses unfunded services and coordinating with existing providers. The centers will help individuals get the help they need for that long-term recovery. We have endorsements of the sheriff, the East Baton Rouge District Attorney, Bill Moore, who you'll hear from in a few minutes, Bo Clark, who you'll also hear from in a few minutes. We also have all of the 4 mayors in the areas, the Zachary Mayor, David Armand, Mayor Judy Peter Shelton from Central, Mayor Darnell Waits from Baker, and Mayor President Sharon Western Brooks. So all of the surrounding mayors and communities have endorsed this tax because they understand how important it is for us. So what can you do? Of course, you can vote yes, talk to other people, follow us on social media. We have a Facebook page at Mental Health VR. You can go to mentalhealthdr.org, download and share our one-pagers. What I tell people more than anything, this is our one chance to show that we believe we need mental health services in this community. We talk about it all the time. We hear it in the media across the nation about how important it is. You know, when we talk about school shootings or any community crisis, mental health services come up. This is our opportunity as a community to show we support those services and recognize how important it is for our community to improve our community for the future. So spread the word, let other people know, and also, like I said, make sure people go read up on it before they vote. So I'd like next for Hiller Moore, the DA, to come talk and just talk a few minutes about why it's important to his area of expertise.
Good evening. Pleasure to be here today. So I really think this is our last chance to get this done. We tried to have this measure passed last time. In fact, last time we were asking for 2 million, not 1.5. We've since cut it down some based on some further research we had. But this is our last chance to really get this done and get it right. Baton Rouge is a sick part of our community that needs our help. And oftentimes we treat animals better than we treat humans and individuals. And there's this group of people have a significant issue that has to be addressed, and it's not being addressed at this point. What we're seeing, what I see often, is those folks that have a mental health issue are being jailed and incarcerated because they may have committed some criminal offense. Most of the criminal offenses that we see by and large are criminal offenses against their family, their neighbor, someone that knows them, someone who really does not want them incarcerated and wants the issue addressed, wants their problems addressed. But the only way that they have now to address the issue is by calling the police, having the police come out and do what they do, either taking a person to jail or taking them to the emergency room. Neither one of those places are reasonable to a reasonable mind to take a person suffering from mental health issues. What we see often is that it's the parent or grandparent that's being abused, being beaten, or things are being stolen from that parent's house. At a meeting we went to 2 weeks ago, when we described what we normally see, that is a family member whose son, who's sometimes often very educated, has done some really stupid things and has hurt the parent. And after we described that scenario, the older gentleman in the back of the room raised his hand and said, "Mr. Moore, my son's in jail. He's been in jail for several weeks now. My son has a significant mental health problem, and there was nothing else that we could do but to have him arrested. He quit taking his medicine. He was not following the regimen that was set up for him by a doctor. He actually had insurance, had a health care provider, but that child, his son, was not applying what he was given, and that person was in jail." Following that conversation with him, phone calls were made between myself and the coroner's office and by the doctor at the parish prison, because that person would never have been identified to me as that person. He came across as John Doe, who committed a battery on somebody. You have no idea that that's his dad. But now that you look down a little quicker, a little smoother in there, you find that this is a mental health issue. This person does not belong in jail, belongs in treatment. That person was evaluated, was taken out of the parish prison, was brought to a hospital where he's been stabilized. The father called back and said, "My child is now welcome back in my home. I appreciate the opportunity that was given." So what the Bridge Center will do is it'll stop you at the parish prison, stop you at the emergency room. He would have had the opportunity to bring his son to the Bridge Center. The Bridge Center would have assisted him, kept him 3 days to 5 days. Following, they would have bridged the services that he received for 3 to 5 days into treatment in the future. Assuming that there's still a criminal charge, that is maybe his child beat up or stole from a neighbor that wasn't quite as giving as maybe the father was, I can now explain to that neighbor, this person has a mental health issue, this is the reason why he did what he did, and look at the services that he's receiving now. So this serves not only that person who's in the mental illness, it serves his family, it serves the police departments, it serves the courts, and eventually serves our community. This is desperately needed from where we sit. We believe that the population of the parish prison, in some way or another, have probably 60% of the inmates have some type of mental illness. And generally we see mental illness on top of alcohol and drugs. And I'll let Dr. Clark talk a little more about the opioid epidemic that's going on now and how that really interfaces with mental health. So I believe that this is the right measure to do. I've already voted for it. And I ask anyone that's listening to the program, consider for $1.50 a day, consider for $18 a year your child. This is the best insurance policy you can take out from your child, your family member, your neighbor. Otherwise, you're going to spend $1,500 minimum on a bond. You're going to get no help from your child. You spend a minimum of $5,000 on a lawyer. Should you hire a lawyer, that $6,500 is not going to help that child whatsoever. But for $18 a year, you could save that person's life. So I encourage everyone to vote for this measure. Dr. Clark?
Excuse me.
Good afternoon. I'm Dr. Bo Clark. I'm the East Baton Rouge Parish Coroner, and like Hiller, I voted early as well. I think what you have to do is frame what's going on in our community like this. We have now begun to reinstitutionalize our mental health population, but we've put them in the prison. And nobody in this room, if you were having a heart attack or a stroke today, would say, call 911 and take me to the jail so that I can be treated. No, you would say, take me to the appropriate medical facility because that's what is appropriate. And that's what we need to start doing with our mental health population. I deal with over 9,000 individuals a year through the coroner's office that need involuntary commitment through our legal system. These are people that need help for their mental illness, and that doesn't include the number of people that potentially end up in jail, because when they're in jail, it's a whole nother system. So that's why it's important. I also want you to recognize the fact that right now, currently, we are in probably the worst epidemic this country has ever seen, and that's the opiate epidemic. I imagine by the time we're through the epidemic, it's going to take more lives than anything else. And that's scary because a lot of times this mental health population, the population that we're talking about, has co-occurring issues with substance abuse. So not only do they have issues with bipolar disorder, schizophrenia, or other types of psychiatric illnesses, but they also have problems because they abuse opioids, they abuse other drugs. So that's what makes it very important that we have a center where we can appropriately triage people and get them the services that they need. And I truly, truly believe that at the end of the day, what we're really going to do is we're going to save people's lives. And that's really what's most important. As the coroner, if we save somebody's lives, maybe it put me out of my job because I don't have to investigate their death, but that's a good thing, is that we save their lives. So next I'll turn it over to the Chief.
Chief Murphy, Paul Baton Rouge Police Department. Historically, as law enforcement, we have treated both mental illness and addiction like a crime. That's what we've done historically all across America, not just here in the city of Baton Rouge. And the reality and the truth is that mental illness is a disease and addiction is a disease. And we have to start beginning to treat both as such. Right now, when my police officers respond to an incident of an emotionally disturbed person, right now we have two options, and you heard it earlier, that's jail or to the emergency room. And neither one of those facilities provides the care that those individuals need when we come in contact. So I can't publicly come out and support it because of my position as a civil servant. What I can tell you is what it's going to do for the Baton Rouge Police Department. And what it will do is it will free up our police officers to focus on that small group of individuals that we believe are responsible for a majority of the violent crime that happens in our community. That's what it will do. And having a stabilization center stops this revolving door right now. When we arrest someone and we don't treat the issue, then we deal with those individuals over and over again. Last year, Baton Rouge police officers responded to more than 2,700 calls for services involving someone with an emotional illness, mental illness. That's a lot of hours, over 11,000 hours. If we go to the small end, it takes about 4 to 12 hours in many cases when we make an arrest. We can be more proactive with the resources that we have, and we can really begin to make more of a difference here. You know, we look back at our past. You heard about the opioid epidemic that was just talked about, how it's affecting everybody. We can learn from our response from the crack cocaine epidemic because we got it wrong. We got it wrong. And what this does, this gives us an option to divert those individuals who don't need to go to jail, but they can get the care that they deserve. And I'm going to end it on this one because I'm going to give you a real life scenario. You know, when I was blessed with the opportunity to be your chief of police and lead this police department, I remember prior to taking this job, I sat down with a former chief, LaDuff, and he shared with me that unfortunately one day I'm going to get that call. And it's the call that no chief of police wants. It's that call when one of his police officers is shot in the line of duty. And I received that call a few months into this position. And I remember going on the call, and the call for service was a young man who had shot at his mother and his sister because they were trying to get their car back, and he wasn't ready to give it back, so he shot at them, his loved ones, people who cared for him and loved him for many years. And one of our police officers just happened to try to initiate a stop, and that guy shot our police officer several times, and thank God he went home that evening. Not that evening, but he lived after being hospitalized for a short period of time. But what I remember most after leaving the hospital that day, making sure that our police officer was going to be okay, DA Hillamore and I were on the scene and we talked to his mother. And when we was on the scene that day, all she talked about was how many times she tried to give him help. Tried to get him help. And she talked about all of these opportunities for intervention, but she couldn't find help. This bill will allow a mobile assessment team. Just imagine if we had a mobile assessment team of professionals who could have been deployed to answer those calls that the mother had called for repeatedly over and over again. That maybe our police officer would not have had to deal with the issue that day. That's what this can do for the Baton Rouge Police Department. Thank you.
I do want to mention that all four of the people that are being the other three individuals, as well as the sheriff, are all on the board, as well as the EMS director is on the board. Director of the Homeless Coalition for Baton Rouge, representatives from East Baton Rouge General, as well as Baton Rouge General, as well as the Lake, are also on board, representing all of these significant areas that are affected by mental health in Baton Rouge. So open to questions. We have everybody here. Yes, sir.
You mentioned in your opening remarks that state funding had, quote, dried up, unquote. If the return on investment is such as been depicted here, particularly with regard to emergency rooms, why has the collective coalition not been able to impart upon the present governor the need for that funding, especially since emergency room visits cost state dollars? Why has there apparently, I'm assuming, has been no success in imparting upon the current governor funding this thing as opposed to putting the burden upon the local?
So the question is, why have we not had state funding when I mentioned in my opening remarks that state funding had dried up, and why do we not currently have state funding to provide these services rather than local?
Yes.
And the answer is that, you know, a couple of things. One, local funding is always better because you can You know the needs of your area. You can use it in ways that are much more significant to your particular community. State funding is something that every year is up for a budget cut. And every year you risk that a program that started and was successful, risk that program going away. So while certainly it'd be wonderful if we had a state funding that would provide these services, because like I said, they're needed all across Louisiana, not just in East Baton Rouge. Unfortunately, we've not been successful for that. There have been attempts both by me as well as by other administrations to make these services funded. They have not been. So at that point, rather than saying, you know, we can't say these services aren't needed. We know they're needed. So we then look for other sources of funding, and local funding, like I said, provides more accessibility to the community in terms of, and accountability to that local community as well.
Thank you.
Yes, sir.
In the ordinary course of events, would these people be eligible for Medicaid? Are there some additional funding streams? You mentioned private funding in San Antonio. What are the additional funding streams?
Absolutely. And the question is, are there additional funding streams for these individuals that are eligible for Medicaid and other funding sources? One of the things that we did when we went back and looked at our why the tax get passed and what we needed to do to make sure that we were only asking for what we needed was to look at Medicaid expansion and what that might provide. And I may have mentioned that, I don't know if I did. They do provide they do fund some of these services. They just don't fund them in the full continuum of services. So there are gap areas that are not funded by Medicaid. But to answer your question, this $6 million isn't going to cover all of these services. We will be using, whether it's private insurance, there are insurances that pay for some of these services. We will be using Medicaid and Medicaid expansion to pay for these services. As I mentioned earlier, we also have grant funding for jail diversion. So we will blend all of these fundings to make sure that we get everything that we can possibly get to provide these services. Yes.
Why is it more appropriate to give this money directly to the Bridge Center instead of an existing political entity which could then put the job out through a transparent RFP process?
Well, and the question is, why was the funding, what is it more appropriate to give the funding to the Bridge Center rather than to an entity that's either already existent that could provide, could put that funding out to an RFP, correct? Is that right? So the Bridge Center was established specifically for the purpose of providing mental health crisis stabilization. That is their sole purpose, is to provide that. When you provide that funding to other entities that might have more diverse needs, sometimes that funding then gets split up with other needs in that agency. We believe very strongly that the model, and again, the model that we modeled it after in San Antonio, utilize, as I said before, both public and private funding. I think that, again, it's very, very important that you have a local source of implementing those funds and not an entity that is subject to every year being cut or reduced, and where those services may be at risk because of the funding sources. Yes, sir.
When will the tax come up for renewal again?
10 years. It ends in 10 years. I'm sorry, the question was, when will the tax come up for renewal? It's a 10-year tax.
Okay. You talked about other funding sources, blending them all together. Has the Baton Rouge Area Foundation committed any specific amount?
Well, the Baton Rouge area, I will tell you, the Baton Rouge, the question is, I talked about blending different sources of funding. And has the Baton Rouge Area Foundation committed? Baton Rouge Area Foundation has funded the majority of all of these initial services, the studies that were done, trips to San Antonio, working with the councilmen, getting them to San Antonio, funded an enormous amount, and I don't have the total dollar amount, and I can get that for you if you'd like, but they've funded an enormous amount of setup services, startup services, and have committed to continue to do that till we get these services up and running.
So another source of funding, my appreciation is there's a lot of money about addressing opioid addiction, problem from the federal government. Where does that flow now?
And the question is, where there's a lot of money that has been put from the federal government that has been and put into states, and where does that money flow? A lot of that money goes to the Department of Health. There's money that there are some local entities that do have those funding. Capital Area does get some opioid crisis funding, and Capital Area is, should have been said earlier, a big part of the planning for this. And they are on our board, and they helped in the development of this plan, and will help as well in the implementation of this plan. So again, we did not want to duplicate anything that's out there already. So what Capital Area is doing, or the department is doing in terms of opioid crisis, we will coordinate and use those resources that they are currently implementing through this opioid money. But the majority of it, like I said, is through the state or through the local Capital Area also has some funding. There are some. I will say there are also some private grants to individual agencies. Other questions?
Are you concerned about the low voter turnout from last year?
And the question is, am I concerned about the low voter turnout? And certainly one of the things that I think is really important, I think everybody understands how important this is, but people don't get out and vote for it. It's all for nothing. We're not going to get anywhere. So yes, I am concerned. And of course, there was an article that came out last week that indicated the low voter turnout doesn't bode well for taxes. So we're certainly hoping that's not the case, and that people that support this are the people that are going to, even if it is a low voter turnout, that the low voter turnout that is there will support this tax. Yes, sir.
You spoke earlier about the prison population with mental health and mental illnesses. One, how is this going to reduce our prison population? And two, how is it handled now whenever somebody discovers certain mental illnesses?
Wait, okay, so the question was, two questions. One, how is it handled right now in terms of the prison population? How do they get there, basically, when there's a call? And also, what was the second part of the question?
What's the expected reduction that we would process?
Oh, expected reduction. So we anticipate that we will be able to serve about 5,000 people a year. The facility is, and I want to mention as well, the facility is not going to be a new facility. We are going to use an existing building, lease an existing building. We're not going to build anything new. But we anticipate about 30 beds, which doesn't sound like a lot of beds, but they're very short stay beds. So we actually anticipate that through the assessment team, the sobering center, and the crisis respite beds, those short stay beds, that we'll be able to serve about 5,000 people. Now, not all of those were individuals that would go to, that would normally go to jail. Some of those are going to be people that would go to the emergency room. And I want to say, did we say it was like 50-50, that in the old M here, there are about 50% of people that would have gone to jail, and about 50% that would go to an emergency room. So again, we believe that at least 50% of those individuals are individuals that would probably have gone to a jail. Can I answer both points? Sure, I did. Okay. Yes, sir.
How many people are actually going to be staffed by the center, and are you concerned at all about there being like an early influx of people coming in right when it opens, and can you actually handle that?
So the staffing right now is set up at about 45 full-time equivalents, that's psychiatrists, social workers, nurses, other individuals. The concern in terms of, I tell people all the time, this isn't a panacea. We're not going to all of a sudden solve all of the mental health crisis. So certainly there's concern that, there may be an influx of individuals and we still end up diverting people to jails or emergency rooms. But we believe over time that we will either be able to expand some of that if needed, or that it will be enough to handle the population. And again, San Antonio has a larger number of beds, but they've got a larger population, and so we kind of prorated that to come up with the amount for that route. So we believe it's the appropriate place to at least start. Other questions? Yes.
When are you aiming for this facility to be up and running?
Question was, when are we aiming for the facility to be up and running? So, the tax is, because it's a property tax, we actually don't get the tax until January of 2020. What we are hoping to do, though, is to either work with the city or to work to get some advance payments for those services. For those funds. And if we can do that, we will start immediately with starting hiring staff and getting space. And we've done a lot of preliminary work to be ready for that. And if again, if we can get the funds, we think we could be open probably, it's still gonna take 6 to 9 months. So we're looking at end of next summer, beginning of the fall next year. Yes, sir.
Have you considered the possibility of getting a grant from a foundation such as Robert Wood Johnson to set up a 2-year demonstration project to fund this?
We have actually gone after several grants. We did get a MacArthur grant, which funded our jail diversion program. It's a very small grant, $50,000. We do have some extension and got some extended money for that grant, which is, I think, about $200,000. We actually applied for a $2 million grant. We were not awarded that grant. And we have looked at grant funding throughout to find out if they had funding that would supply us. We weren't able to get that funding. Yes, sir.
To repeat the question that I'm gonna ask, when will you get the money? How much money will you get for 10 years, every year for 10 years?
The question is, how much money will we get every year for 10 years? And it's anticipated based on, again, the tax assessors who makes the determination and collection. It's anticipated about $6 million every year for 10 years. So $60 million over the course of the 10 years. Other questions? Yes, sir.
Do you think that the roads tax is having any kind of effect on people's voting habits on your tax?
And the question is, do I think the road tax has any kind of impact on our tax? I don't really think it does. Not the best political strategist, so I don't really know. But I do think, I think they're separate issues, and people are looking at them as they're separate issues. One's a sales tax, one's a property tax. So I don't see that they have an impact on that. But again, like I said, I'm probably not the best person to answer that. Oh, potential, question was potential location. I mentioned before that we would not be purchasing any building. We are looking right now at Baton Rouge General, the old General Hospital. We actually toured it 2 weeks ago. It's actually remarkably perfect space for this, has good security as well as good access for the community. We're not committed to that at this point. And there are some other new spaces out there. There's the Women's Hospital that we would also potentially look at. Right now, probably the front candidate is the Baton Rouge General, just because the space is well kept up and it's also very conducive to the types of services that we anticipate needing. Yes, sir.
Are there any other areas of Baton Rouge that might likely be part of this grant? If Baton Rouge General, like, if you're looking at Baton Rouge General, how about other areas of that?
Well, and the question is, what about other areas of Baton Rouge? Would they benefit from this as well as they would serve? And it will serve all of East Baton Rouge Parish and surrounding. I mentioned the cities of Central, Baker. All of those will be part of the services that they will receive. In terms of, we certainly have to start in one location, and there will probably be a central location in Baton Rouge, but all of those other communities will have access to that location. Other questions?